Hello, my name is Rachel, and I'll be doing the abdominal assessment for Nursing 283. Alright, first, before I enter the room, I'm going to wash my hands, and then I'm going to introduce myself to the patient. All the while, I'll be checking their level of consciousness. I'll be doing my general survey, looking if they're appropriately dressed for the day, if they're oriented. Next, I'm going to inspect the abdomen. Generally, they would not have a shirt on for this, but for this purpose, we will keep them clothed. Next, I will be using the diaphragm of my stethoscope to be auscultating the abdomen. I'll go in all four quadrants, quadrant 1, 2, 3, and 4. Next, I will be using the bell of my stethoscope to be auscultating the renal artery, and that's going to be to the right of the umbilicus and just above the umbilicus. Next, I'm going to percuss all 4 quadrants, starting with quadrant 1. Now I will be hearing tympanic sounds, all 4 quadrants except over the liver and spleen, which will be dull. Also, if the patient is full of stool, they will also be hearing dull sounds. Alright, next I'm going to palpate all 4 quadrants using 2 fingers. So just some light palpation here. Feeling for any herniations, any distensions at all. And next, I will be doing a deeper palpation. Can I have you take a deep breath in and then let it out, please? So using 2 hands, I will palpate the liver over here. And unless it's enlarged, I will not be able to palpate that. And then I'll do the same on the left side here for the spleen. Can I have you take a big deep breath in and let it out? And the same there. Next, I'm going to feel for the femoral artery pulse and the inguinal lymph nodes. So just on their inner thigh, just palpate there. I'm going to feel for the hips on both sides, make sure they're equal distances apart and they're parallel. Alright, next I'm going to be putting him through some passive ranges of motion. So I'm going to the leg up and then extend it out, looking for that full range of motion in their hips there. And here too, making sure they're not feeling any pain or discomfort with those motions, clicks, anything like that. Now can you do those 2 motions on your own? Good, good. This concludes my abdominal assessment. Thank you.